Hi guys, so I've been asked a lot of questions about our new line of fillers called the RHA line of fillers, and so I just wanted to give a little quick introduction about what they are. They're basically long-chain hyaluronic acid-based fillers that have the ability to be quite flexible within the skin, giving a nice natural sort of appearance. And these fillers, the RHA line, typically are used for a lot of different volumizing purposes in the face, including sort of mid-face volume, what we call these nasolabial folds. We can even use them in the lips or under the eyes. They're essentially pretty all-purpose fillers. There's several products within that range of line that can actually be applied broadly across a lot of different areas.
RHA fillers are a brand new line of fillers that came from Swiss technology. They're designed to be more natural, just like the natural hyaluronic acid that's in our skin. So it's a new technology with less cross-linking, so it can move very naturally and be very natural with any movement, with smiling, no stiffness, and made to last a long time, up to 15 months in 2 pivotal studies. RHA fillers can treat many different types of problems, mostly lines and folds in the skin. The R means resilient, and H is for hyaluronic, A for acid. So resilient hyaluronic acid, it's made to withstand movement. Now the filler that's number 2 is the lightest weight one for fine lines, like in these smoker lines. That would be great. And to prop up the corners, what I like about it is it doesn't bulk anything up or push tissue over. It just integrates very naturally in the skin. RHA 3 would be for deeper folds, such as maybe real deep folds here or deep marionette lines. And RHA 4 can be used for smoothing the cheeks, for temples, for very severe folds. So the whole line kind of covers a spectrum of problems that we usually treat in our office. Besides the lines and folds, we're also finding it very useful for the lips, for example. Patients like the smoothness and the movement. Some products can be put a little bit towards the eye for the dark circles, and even for getting a smooth cheek. These are off-label uses, but already we're finding them this whole line very helpful in those areas as well. After a treatment in the office, when you look in the mirror, you'll see a result right away: softening of the folds, smoothing of the cheeks. But it usually swells, like all fillers, for a day or two. There's usually very little downtime, but you can expect maybe a few days for everything to smooth out completely, and then you'll love it. But right away you see a result. Who is a good candidate for RHA? But I think because there's 3 different types, we can treat anyone from the very young female who's just noticing a little bit of shadowing or wants a little bit in the lips, to someone who's older, has more severe aging and needs a lot of volume replacement. So I would say almost anyone's a candidate who has some aging. Before and after any fillers, there's a few things you can do, such as before, don't take Advil, aspirin, things that can make you bruise, or even fish oil. And afterwards, the RHA line is just like any other. It can bruise a little bit, so we give you an ice pack, and you can ice it a little bit. You don't want to exert yourself or get super hot for a couple days, because that can make them bruise a little bit more. You wouldn't want to lay down and smush your face with a massage or a facial. So just kind of common sense things where you're not pushing on it a lot for a couple days, but there's really very little downtime and not much post-op care that's needed.
Hey guys, this is Dr. Wu at Cosmetic Laser Dermatology, and I have my lovely patient with me today. Today we're going to do a little bit of a demonstration of some filler products, namely the RHA line, and we're going to use actually all three of their products, the RHA 4, RHA 3, and RHA 2. RHA is a class of hyaluronic acid-based fillers that have really made a name for themselves in terms of how natural and how beautiful they can give in terms of a nice fill. So we're going to kind of go through some of the areas that will require a little bit of volumization, and then we'll go from there. Our patient here has some fairly standard patterns of volume loss, especially throughout the mid-face area, okay, as well as the so-called nasolabial fold and the so-called pre-jowl sulcus. Okay, these are three areas that I think we can make a lot of improvement with the RHA line. Additionally, as is natural with just time and genetics, we get a little bit of volume loss in the lip, and I think a little touch in the lip to restore some of that natural volume will be really nice. We're going to start with the RHA 4 product. I like RHA 4 because it tends to give a nice lift to the areas that we're treating and apply a little bit of structural replacement, as well as give a nice soft fill. Okay, and so I think it's one of the ideal products for the mid-face. As you can see here, the cheek area, the so-called medial cheek area, most of the volume has been maintained quite nicely, but we can see that there's a little bit of a drop starting at about here and coming downwards. And so placing a little bit of RHA 4 into this area to lift this part up is going to be actually really quite nice. Okay, and then building further out from that, our patient has this beautiful cheek structure, but it has decreased a slight bit, and so if we can reestablish some cheek structure here and give a nice little lift, that will be perfect. And then finally, for the mid-face, we never really want to have too sharp of a step off between our cheekbone and then the rest of the cheek, and so I'm going to soften that a little bit. Volume loss in this area contributes to sort of downward descent of all of the other skin and tissue, and so if we can reestablish some support in this area here, that will contribute to our lifting effect and give a nice blended sort of look throughout this cheek. That's going to be the plan for the mid-face, and why don't we get started with that first, and then we're going to move to the other areas. Okay, so you can already see our shape taking place here. We're getting a little bit of a lift in this area here, and that's already giving a softening of our nasolabial fold. But we're far from finished here. So our next goal is to make sure that we have a smooth transition from the medial cheek to the lateral cheek. Okay, we don't want any sort of step-offs, but we want to reestablish this structure here and give a nice, beautiful cheek. A little bit of a pinch here. That's just a drop of lidocaine. Still feeling okay? Mm-hmm. Beautiful. Okay. And now we just do a gentle restoration here. One thing that's really nice about these fillers is that, of course, they come mixed in with a little bit of lidocaine, and so they kind of numb as they inject. And so the entire process, if we do it right and get a little lucky, tend to be pretty pain-free. Wonderful. So we've managed to reestablish some structure in the upper cheek here. And now we want to continue to revolumize this area here so that we can get an even nicer lift. Okay. One thing I really like about this particular filler is that it's very moldable, and so it integrates into the tissue very nicely to give a very nice natural kind of fill. Wonderful. Okay. So that's essentially the mid-cheek volumization. You can see, although there's a little bit of swelling, and bruising can sometimes happen with any sort of injection process, you can already start to see that there's significant lift on the right-hand side versus the left because of this restoration of volume. And this advantage can be actually seen throughout, even in areas that were not injected yet, including the nasolabial fold and this pregal sulcus area. So this product is going to integrate very, very well into the soft tissue here and give a very nice natural kind of restoration. Okay, so we're going to move on now to the next part that often is marked by loss of volume, and that's specifically the nasolabial fold here. Okay, the product that I'm going to use in this area here is the RHA 3 product, and this is ideal filler for this region. It also gives a very nice soft fill without ever looking overdone, and it can be very, very nice in this area. And you can see instantly the nice soft correction of this area. And again, if we do this correctly, this is essentially a pain-free injection. And now we have a smoother transition from the nasolabial fold to the medial cheek, to the apex, and then to the lateral cheek, so that it all lifts upwards and restores, in a very natural and anatomical way, the volume of the mid-face. This area here, this is an area that we have to be a little bit more cautious in treating, because we don't want to put too much volume in there. But it is a classic area of volume loss, so just a touch in this area is going to be very nice. And again, with the RHA line of products, I'm never worried that the filler will not integrate well. It always integrates very, very well and gives a very smooth, natural fill without the risk of lumpiness. And that's because of the innovative technology in this gel that allows it to have that flexibility and that smooth, natural filling ability. It's done here. And you can really see a difference between the right-hand side and left-hand side, although it doesn't pop out in the eye in terms of it's not jarring, the difference, but it's still a nice, natural, smooth improvement. And you can see how all of the transition zones of the face are now smoother and more lifted, and we get improvements even in the jawline contour, as well as the entire mid-face. And now I'm going to switch to RHA 2 and just put a little bit of light volume into the lip. It's not that we necessarily need to increase the size or change the shape, because the lip is still very beautiful in our case here, but just to give that more plump and hydrated type of look. I think that is a very nice, soft, natural touch that always looks good. Part your lips slightly, please. Thank you. Oh, pinch here, sorry. A little bit of a squeeze here. You still feeling okay? Mm-hmm. Good. Lip injections can sometimes be a little bit more sensitive, and so there are times when we would put a little bit of numbing cream on the lip prior to doing this. But with gentle technique and relying on the lidocaine in the product already, you can sometimes get away with a reasonably comfortable lip injection. All right, so we've done kind of the right-hand side of the face so far, and although there are always going to be a little bit of swelling and stuff like that may obscure kind of the view, but we can already see kind of the immediate benefits of this treatment. First of all, the cheek structure has been reestablished, okay, and so there's a beautiful cheekbone that has been restored. The transition from our middle cheek to the lateral cheek is nice and smooth, and we get a beautiful lift in this area here. That is helping actually to lift up the jowl area as well as lift up the so-called nasolabial fold. But we've also slipped a little bit of volume into this area here just to make this transition a little bit smoother, and a very small bit of volume into this so-called prejowl sulcus to try and lift this area as well. And finally, we did a little bit of in the lip to restore some of the natural volume that has been lost over time. And so that's the right-hand side. Okay, and there we have it. So we've now we've completed our injection treatment session, and you know, both sides have now been restored in terms of volume. We were able to use different products for different areas of the face, and that's because each of these products has slightly different properties to them. The RHA4 gives beautiful lift and structure into the mid-face. The RHA3 is a nice, soft, smooth filler, more for soft tissue filling, such as the nasolabial fold and the prejowl sulcus. And the RHA2 gives a nice finish to the lips, never overdone, but just a light volume that gives a nice, hydrated, plump sort of look. And that's that.
Hi, I'm Dr. Butterwick, and I'm here for a lovely demonstration of a new filler called RHA. We have a wonderful patient that you'll see tonight that will demonstrate the whole range of this new line of filler. The RHA line is a hyaluronic acid. It's very, very safe. It's made in a way that is very soft and pliable. It's long-lasting, and it's smooth. It's a very good smoother. We're going to look at our patient now, and we'll kind of analyze where she needs it. So we look at her, and she has, you know, a lovely oval shape. She's very pretty and lovely smile. But there's some folding, some shadowing here that we're going to be improving, some volume loss in the temple. If we look at her eyes, put your chin down and look up at the ceiling. You see that she's got these kind of circles here, and we're going to soften those with the RHA2. Her cheeks are lovely. She's got nice volume. We just want to pull them back a little bit. And the RHA4 is going to be lovely there. It won't make her too wide. It won't be too much, but it'll be a lovely just enhancement of the cheek. And you see that's going to pull the cheek back away from this fold. We will be putting some product here, probably the RH2. That's very soft and forgiving. It's not going to be bumpy. It'll just soften these nasolabial folds. We see that her chin could use a little bit of volume. It's trying to just get a little contracted there, and so we could smooth out the chin just a little and bring it forward. Lastly, on her lips, you see there's a little bit less volume on the left or the right lower than the left lower. Her lips are pretty, but she likes them bigger. And not too big, but her face has lovely volume, so her lips can be bigger and they'll be very pretty without being overdone or unnatural. So the RHA line gives a very natural look. So shall we get started?
Let's get started.
Okay. Okay, now she's all ready. I did a few little numbing dots, so this isn't going to be painful for her. So don't worry if you're going to get this filler. It won't hurt too much. We always try to make our patients comfortable, and then we're going to clean the face with some special soap. Now this is RHA4. This is the one that is designed to be a little thicker, and it's going to lift a little bit, but lift smoothly and give natural, beautiful contour. She had some shadowing over her brow, and I'm going to treat that next. So here we go. A little slowly, and we're just going to watch. So we see here some lift compared to that side, And next we're just going to lift the cheek up a little bit this way. She has plenty of volume here, but we'll pull it back and up, and that will be a lovely look. I'm going to use a cannula. Now don't get scared because it looks a little long, but we've numbed this so she's not feeling that. And then we're going to use this cannula that's not a needle. We'll slowly remove that and replace it with this. And just add a little volume here. And this is not a needle, so it's unlikely to bruise. And we're just going to go for a little elevation, which when you add volume to the upper cheek, it sort of slims the face down, believe it or not, and it gives her a lifted look. So you see we've lifted and we've slimmed the face down on this side, and we'll later do the other side, but I'm going to show you all one side first. Next we're going to do the tear trough area, and this is going to be with RHA 2. Now we have the cannula, and we're going to reach up and fill some of this up very safely. And then open the eyes, and you can see it filled in that dark circle. Okay, I just added a little bit more, and you see compared to that side it just takes the shadows off. Next we're going to do her lips, and she likes a big lip look, so we're going to go for RHA 4, although usually we would put 2 or 3, but she's used to a lot of different fillers, and she likes the look of a bigger lip, and it suits her face well. So here we go. Part the lips for me. Open the lip just a little. I'm going to aim here, pinch. Okay. Now her upper lip has half a syringe of the RHA 4, and it looks lovely, just smooth. There are no fine lines. So it's not going to be a stiff product or look overdone. It looks very natural. Now we're going to do her lower. Now we're just going to smooth the chin out a little bit, where she had a little bit of unevenness. Okay. So I put a little RHA 2, but I think we need the thicker one, so now I just came back and put a little bit of a thicker filler here to help that fold just a little bit more, to bring it up out of the shadow. And so that's going to look very nice and smooth. And we might do just the corner of this lip to bring that little comma, to bring that up. Okay, so now to summarize, we put the RHA 4 to lift the brow compared to that side. We lifted the cheek and slimmed the face down with RHA 4. We did RHA 2 under the eyes and made that much more bright and radiant. Here we use the RHA 3 to bring that forward and soften the fold there. And we did the RHA 4 in the lips, which are beautiful, as well as the chin to balance the chin. And this side still needs to be done. Well, as you can see, we're all finished. We've got the temples, RHA 4, RHA 2, RHA 3, and then this is RHA 4, but I did a little lip liner with RHA 2 to get that nice set edge for your lip liner. And what do you think?
I love it. I love it. I look a lot younger and thinner.
Yeah, she noticed when you lift the cheeks, the face looks thinner. Even though we're adding filler, so she looks great.
Thank you. Beautiful, thank you. I was just mentioning that I did not feel any pain at all. It was not painful. The lips a little bit, as usual, but not at all. It was no pain.
Dr. Butterwick?
Nice job.
Great job for you. That was amazing.
You too. Okay, well, I guess thank you everyone for participating tonight and listening to us and watching our patients get new and improved. I think we're going to answer some of your questions. So, shall we just trade off, Dr. Wu? You can.
Yeah.
Uh-huh.
I think that's a good idea, and then we can jump in if we feel like it.
Okay, well, the first one says, is this a lot more expensive than other injectables? And no, it's in the same range as all the fillers. So some fillers are a little more expensive than others due to their duration and their structure, but really they're all kind of in a similar range.
Yeah, I think cost is always a big question, and I'm not sure what you feel about this, Dr. Butterwick, but mostly the cost will depend largely on the consultation. What each patient needs, will determine kind of the final cost of the treatment. But yeah, in general, the cost is very similar amongst most of these fillers.
Mm-hmm. Okay.
So let's see.
You want to take that next one about the temple?
Okay, yeah. So, well, this one actually, maybe Dr. Butterwick, because you did the upper temple.
Oh, yeah.
Yeah, so maybe we can defer this one to you.
Yeah, okay. It says, I see you did it in the upper temple, but what about closer to the eyes, and does it make the veins pop out there? Well, in the temple, there's a safe region, and it's right here. And then we can take our cannula and go superficially in this area. If you say closer to the eyes, you might mean this tear trough area, and I did that on the patient with a cannula. So we can go close to the eyes, but we always want to stay just along the orbital rim here, not really way up by the eye. And we can even do the upper eyelid. Sometimes we need to add some volume all around the eye to frame beautiful eyes. And when the question is, does it make the veins pop out? When we first do it, the veins might look a little bit more dilated for about a few hours, but it's just a temporary effect. So don't worry about that. I have never, ever seen the veins stay that way permanently. Now, some people do have veins there, and we have a great laser for removing those veins.
Yeah, Dr. Butterwick, I really loved how you did that temple and the under eye area. It looked so nice. Yeah, so I guess the next question here is, how long does the treatment last? And that's partially, reliant on how much filler is used and in which locations. But in general, under average sort of circumstances, this treatment will last roughly about, I would say, a year or so. And again, depending on how much is used, but a year, sometimes even a year and a half, would be my what I find actually in my patients. What would you say about that, Dr. Butterwick?
Yeah, well, we've just had this filler a year, and I think that we're seeing some good longevity with it. If you put it near a place that moves a lot, sometimes it'll be 8 to 10 months. But in the studies that they did with it, there was still improvement at 15 months. So I think because of the structure of this filler, it's kind of like long tangles of spaghetti that doesn't have a lot of crosslinks, but those tangles make it last a little longer, and it makes it move naturally. So I think this is a great product that we'll find has very good longevity. The patient that I did her lips with the RHA 4, that she's had every filler in her lips, and they just aren't lasting very long. So we went for the thickest one to see if we get good duration. So we will see on that, but it hasn't been too long yet. But I'm hoping that we get in the lips a good year.
Great.
Okay, so the next question. I have had lumps with some other fillers. Is this filler less likely to cause lumps? And I think both you and I would agree, Dr. Wu, that yes, it is a particularly smooth one. Sometimes you can get a little bump in the nasolabial fold or a little bump somewhere else. But this one, it is very, very smooth. And I like it for women with really thin skin Today I saw someone who's very, very thin and her skin's thin and any sort of lump might show. So RHA, the whole line, is a good choice for someone like that. If someone has really super thick skin, they might need the thicker RHA4 to get enough lift. But this one, I believe, is particularly smooth. The other place I love it, like in this corner, so I can stand myself. I could use some, but it will smooth out these corners without pushing tissue to the side. Like sometimes if you get filler here, you just push tissue and you get something else you don't want. The RHAs are so integrated in the tissue that they don't do that, and I think that's a big advantage.
Yeah, the smoothness of the product is really, really nice, especially like you mentioned, Dr. Butterwick, in those thinner individuals. Really quite like that. So actually, this kind of segues into the next question. You kind of touched on this just now, Dr. Butterwick, but when I smile on one side of my mouth next to my lips, it gives a crease line, okay, which is really quite common. We treat this all the time. And the question is, will this filler help fill that in? And will the filler move with my smile? I think these are very good questions to ask, actually, because the answer is yes, this filler can be some of the RHA2 or even the RHA3, in my opinion, can be a very good option to restore some of the volume in those areas. And you usually don't have to worry too much about the filler bunching in this area, even though there's a high motion area, because of its ability to integrate into the tissue and be smooth. So yeah, that is one area that I do like to use these products in.
Yeah. And I see a question just above that from someone I know. Hello there. But the question is, what are the main reasons this product would be used instead of other injectables? And I think it is when we really need that smooth effect on real thin skin. It'll be very nice in people who have need a transition from one area to the next for connecting areas. And the duration. So I think there are many reasons that we've alluded to, less lumping and so forth. Now we do mix and match fillers, and so this is just like having another wonderful tool on our artistic palette. And so I love kind of mixing and matching and choosing which one will be exactly right. And so now we just have another wonderful tool.
Yeah, that's the key. I'm kind of scrolling down the list here for some of the questions that we may have overlooked, but to touch on some of these, there was a question about large needles and needle versus cannula. Some of the demonstration tools that you saw were not really needles, but actually cannulas. And those were a little bit larger in size, but they're very different from needles. And in general, it doesn't actually hurt at all. With a little bit of luck and some gentle touch and technique, usually these treatments don't hurt at all or very minimally. And Dr. Butterwick's patient kind of spoke to that at the end of her demo. The major difference between a needle and a cannula is that one is sharp, the needle, and one is kind of blunt. And so they're just two tools that we use, and they each have their place, and they each can be used, advantageously in certain situations, depending on what we're trying to achieve.
Let's see, am I? Another question is, does it work in the hands? I think this would be a beautiful filler in the hands, but frankly, I haven't used it there yet. It would be an off-label use. We have a couple fillers that are on label, but that doesn't mean we can't use it in the hands. I think I want it in my hand. I think it would be really nice for filling this out and being nice and smooth. So just stay tuned for my answer on that. What about you, Dr. Wu? Have you tried?
Yeah, that's actually a good. I saw that question too. I was like, you know what, this is probably a very good filler for the hands.
Yeah.
But I have to admit, I haven't done it yet in the hands, so tune for that. So there's one question. Can we sort of touch a little bit more on downtime? Well, with most injectable fillers, they're considered, quote unquote, a no downtime procedure. And I would say the two most common side effects, you could say, of fillers that may lead to some downtime are potential bruising and potential swelling. And so these are sort of expected kind of side effects of most injectable fillers. And I would say that in my experience, this is the RHA line of fillers doesn't seem to cause a lot of swelling compared to some fillers that I've used. And so that's somewhat of a bonus there. And the bruising frequency, is not really dependent on the type of filler or not. It's really more on technique and sometimes just luck. The cannula usage can sometimes, be less bruising than the needle usage. But essentially, those are, it's considered almost a no downtime procedure.
Right. I had some not too long ago, and I did get a little bruising because I exercised the next day in some heat. So if you don't, obey your doctor, like I didn't, I went outside and worked out hard. You shouldn't overexert real hard because that makes you hot. It gets the blood flowing, and that's what can trigger a little bit of bruising. But we have a laser here that we use for bruising. So the next day I treated it with a laser and it goes away faster. So we always offer that to you and all our patients. Should you have a bruise, that's just embarrassing. So we help you get through that as quickly as possible by lasering it the next day. I see another question about cheeks. Someone says, I have no cheeks. Will this help? And definitely, I think that it will give a soft, naturally moving cheek. I think a lot of people have been overdone in their cheeks, or they just have these big hard apples, and we kind of move away from that and get a more natural look now. And so I think the RHAs are perfect for that. Depending on how the patient appears, we may need RHA 3 or RHA 4, probably the 4 for a soft but natural cheek.
Yeah, I would definitely agree with that. And it kind of segues into the next question, is this a good product for nasolabial folds? And I think it's a very good product for nasolabial folds. And, RHA 3 or 4 or even 2, to be honest, it really depends on the depth of the fold and the type of patient. But all three products can be used very successfully, in my experience, with nasolabial folds.
Mm-hmm. Yeah. Right. And then there's a question, can you use Botox and filler at the same time? And that's a wonderful combination. That's a win-win combination. Let's say we're using Botox for the 11s, and if there's a fine little line there, we could use RHA2 to fill in the line and do the Botox, and that would have a synergistic effect. The Botox would last longer and the filler lasts longer. This is great also in other areas around the mouth. We typically do a little Botox here for the muscle that pulls your mouth corner down, and that will help your filler last longer. So if there's a little less movement with the Botox, your filler lasts longer, and then you get the benefit of the look of both of them. So yes, we definitely often do this at the same time.
Yeah. The next question, will it improve jowls? So I'll give my take on this, and I'd love to hear Dr. Butterwick's take as well. But in general, yes, volumization, when correctly done, can have a positive impact on jowls. And there are a couple ways to sort of go about trying to do that in terms of maybe reestablishing jawline structure, establishing sort of chin structure, and then sort of lifting from mid-face, mid-upper face, and redistributing volume in that way. And that helps to lift the jowl, usually in a pleasing manner. It may not completely correct the issue, but it's really a no downtime, minimal risk, and non-invasive way to approach that area. So I do that quite frequently, actually, in my own practice. But what are your thoughts on jowl improvement, Dr. Butterwick?
Right. I agree with you. I think it's helpful to realize why the jowls form, and a lot of it is we lose a lot of volume from that face. There are some fat pads there, as well as some deep fat pads that are like little pillows that deflate. So when this fat disappears, the cheek falls forward and makes a jowl, and when this fat gets atrophic, it falls down. So all of a sudden you've got these gels, and we can, by lifting and restoring volume out on the side and along the jawline, you can really pull that gel up. Sometimes we do other little treatments to the gel if needed, but the best thing is lift it up and lift it back, and you'll get some very good improvement. And I think we saw that on both of our patients today.
Yep, absolutely. Great. So there's quite a lot of great questions. We're wondering, we're coming to the end of the list here. Are there any other questions that you guys have some curiosities about that you'd like to ask? Please feel free to type them into the question box. Seems like we're kind of to the end here.
Well, I'll just talk a little bit about the the formation of this RHA line. I don't know if a lot of people know that there's the scientist, this woman, Madame Trudeau, is it Madame Tupin. So sorry, pardon my French, but she developed the Juvederm line years ago, and then she's French, and she now has developed this new line of the RHA fillers that are just softer, natural, very, very nice. So I kind of like that it's a woman scientist and someone who's been working on this for her lifetime, and now this is a new, exciting product that she's made. But it's not that new, so it's not so experimental or anything new. It's hyaluronic acid, and it has been used in Europe for years. So we have a lot of experience. This is the year anniversary that we've had it in the US, and I haven't heard of any problems with it, and I think it's going to be just utilized more and more as we find just the right areas for it.
Great. So, Dr. Butterwick, do you want to wrap this up here? Or?
Oh, okay. Well, I see just a couple more questions, or is it time for the wrap up? A couple more. Okay.
All right. Maybe I'll take one and get one here. Yeah. So, one of the questions: how many areas can one syringe treat? That's actually a good question, because we try as aesthetic injectors to maximize the value of every syringe that we do. But in general, it really depends on what our goals are and which area of the face that we're treating. So, for example, if we're doing a lip, for example, one syringe is often very sufficient to do a lip. Whereas if we're doing mid-face volume like cheek and etc., one syringe might be enough to split half-half, but typically you need maybe ones per side at least to get some nice volumization. Similarly for the temples, I find that one per side on average. It tends to be a good range, whereas the nasolabial, if not super severe, then you could get away with splitting one half on either side, or maybe doing one per side. Again, this is the part of the consultation that is very dependent on what your goals are, and what your personal aesthetic is as well. And so we work very hard as a team to match those goals and to generate that aesthetic that you find pleasing.
Right. Yeah. That'll definitely vary, and fillers can be put in stages. Sometimes we tell people you kind of need a syringe per decade as you get older, because we lose a teaspoon of fat every year from our face starting at age 30. But you don't have to do it all at once. And once we get the look we like, we just maintain it with a little bit of filler. We don't need to use much after we build the look we like. Now, we're just going to mention to you that after this webinar, you're going to receive a text. So if you want to book a consultation, you can. Someone asked if you have a consultation, can you get filler that day? And yes, most likely you can. So we encourage that. And we're excited to announce that whoever's been watched our webinar, you're going to get $50 off each syringe. And if you buy 4, if you kind of go for a nice look, you get the 5th for free. So that's a great buy. So please come see us.
Wonderful.
Any other comments? I see one more question about, is this more natural than any other products in terms of preservatives or additives? I speak to that. I think, well, actually, yes, I can. It has less cross-linking. It's something that can be immunogenic for some people. So because of the way it's made with tangles rather than a bunch of cross-links, it's that helps with that soft, natural movement, and it minimizes the immunogenicity. Although, it must be said, we hardly see any reactions to fillers ever, and the hyaluronic acids are all dissolvable. So it's important that your injector knows what to do if anything goes wrong, and we're on it, but fortunately very few things ever.
Great. All right. Well, thanks so much for tuning in, guys. Yeah, hopefully that was informative and entertaining. If there are no more questions, then I wish everyone a good evening or whatever time limit you're in. But thanks so much, Dr. Butterwick, for joining as well. I really
Thank you. I enjoyed talking to you, Dr. Wu. We're always running back and forth in our clinic.
Yeah.
And get to sit down and talk with each other. Thank you so much, everybody.
All right. Bye now.
Bye-bye.